Good morning. Welcome back to Open My School. Today I will be discussing with you how to approach a patient with seizures. We have in the previous sessions discussed about the various types of seizures and epilepsies and epileptic syndromes. The key in managing a patient with seizure is accurate diagnosis. So when somebody comes with a seizure, the immediate priorities in seizure management is looking at the vital signs. So here you can see the pulse, BP, temperature and respiratory. These are vital. And then go by the ABC or ABCDE approach. Support the respiratory system, cardiovascular support, and recognize life-threatening conditions like an arrhythmia, hypoxia, hypoglycemia, etc. That is the immediate priority. And handling the first seizure episode. A person coming for the first time, verify whether it is a seizure itself. Try to identify the cause and plan anti-seizure therapy. So that is how we approach a patient who comes with the first episode. If it is a patient already having a previous history of seizure, try to identify the precipitating causes and what is the therapy patient is on, and then plan the management. So a thorough history is essential for diagnosis. The symptom differentiation should be by the witness insights of the witness, because it is essential. The patient is unable to get a history, so getting a history from a reliable bystander is essential. And we should ask about clues in the seizure history, like past history of febrile seizures, who are more prone to develop a focal seizure with impaired awareness, that is the previously called the complex partial seizure, with underlying pathology of mesial temporal sclerosis. Always ask about family history and any auras patient had already mentioned. Always unearth the seizure precipitators. When there is a seizure, usually there is an underlying cause plus a precipitating cause. That is very important for patients already having seizures, like sleep deprivation, systemic diseases, substance abuse including alcohol, and certain medications. Think about these things. What is the role of laboratory tests? Once the seizure is managed or the patient has come after the seizure, routine blood tests for metabolic causes should be done. You should have an electrolyte, sodium, potassium, magnesium, and calcium. These are the minimum things. And appropriate cases like some persons are suspecting a porphyria, you may go for other investigations like urine porphobilinogen. A toxic screen is mandatory if you are suspecting a poisoning. If you are suspecting infection, go for a lumbar puncture, and in appropriate cases, go for immunological tests. All patients should have an EEG at the earliest. Electrophysiological evaluation of seizure is necessary. EEG captures brain activity. It detects the activity and sometimes guides in medications. For example, a patient with here you can see the spike and wave discharges 3 per second is characteristic of the absent seizure, and the choice of medication is sodium valproate most often. So that is the importance of EEG. All patients should have brain imaging. MRI is preferred for lesion detection. Newer methods of MRI are very sensitive to detecting structural lesions. When you are suspecting a structural lesion, should always have an MRI plus electrophysiological, that is EEG. What is the role of genetic testing in seizure diagnosis? Sometimes for a definite diagnosis, this is useful. When will you ask for? When the patient has a strong family history of epilepsy. In case of early onset epilepsy, especially in children, when epilepsy presents as part of a genetic syndrome, and when the cause of seizure remains unclear, after initial evaluation, you may go for a genetic testing because many of these seizures are part of channelopathies. Distinguishing a seizure from other condition is very important. Always think in mind syncope, migraine, metabolic disturbances, and here accurate differentiation is crucial. And in the following sessions, I will discuss how to differentiate a seizure imitators. So, in conclusion, a structured approach for accurate diagnosis is essential and is critical for patient care. So, taking the history from a reliable bystander, try to identify it into focal seizure, generalized seizure. If it is focal, try to identify whether it is a focal with awareness or impaired awareness. If it is generalized, identify whether it is primarily generalized or secondary generalized. And then go for the cardiovascular support followed by necessary investigations. Management, the discussion will be in the coming sessions. Thank you.